Okay, we are right at the hour. So I like to be timely and respect our speaker's time. So good morning, everyone, or afternoon or evening, depending on where you are joining us from. I am Dr. Joanne Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges. And before I introduce our speaker for today, I just want to go through a little bit of housekeeping. Dr. Smith, if you can just go to the next slide, please. So you are all in listen only mode. That means that you can interact with our speakers, but you need to do it through the Q&A. We prefer that you use the question and answer box rather than the chat, just so that we can track your questions and responses all in one place. This forum is being recorded, and we will share the link in the recording after when it's ready. And if you have any issues or you have any questions after the fact, please email us at info@aanmc.org. And so with that, I am going to introduce our speaker today. We have with us Dr. Fraser Smith. He is the Assistant Dean of Naturopathic Medicine and Associate Professor at NUHS in Lombard, Illinois. Dr. Smith graduated from the CCNM, the Canadian College of Naturopathic Medicine. He's earned his master's in training and development from Roosevelt University, the former dean of the Naturopathic Program at CCNM. He is also past president of the AANMC, author of books. He's been an editorial member for the Naturopathic Medicine Journal and done so much within the profession, including being vice president currently of the Naturopathic Board of Medical Examiners. And so with us today, we have a stalwart in naturopathic medical education. I am so excited to have him with us. And I'm going to make my face go away and my voice, but I will be here behind the scenes. So Dr. Smith, the show is yours. Thank you so much for joining us.
Thank you very much, Dr. Yanez, and thank you for the great work you do on behalf of our AANMC. It's a pleasure to be invited to do one of these webinars. It's been a little while since I've done one, and I'm always thrilled to do it. And as it often happens, I'll run into someone, sometimes one of my own students, who came to one of these that I was doing. So maybe we'll meet again down the road. So today I want to give you a snapshot of how a naturopathic doctor might approach healthy aging, literally keeping tissue, blood, lymph, muscles, nerves moving, etc. There's a lot we could say about that. This is just a little bit about my trajectory. So I went to Canadian College of Naturopathic Medicine, did a 2-year residency there. Not everyone does residencies, but I really enjoy doing one, just in general naturopathic practice, because I teach and do research and write and have had a lot of clinical experiences over the years, but I'm very involved in education, so I got a degree to make me more up to date with that back in 2013, and slowly working towards my master's in acupuncture here at NUHS. So we'll look at healthy aging and how we work with patients as they get older. We'll try to answer this important question: can some of the phenomena that patients told are inevitable actually be reversed or delayed? Reversed or delayed? The spoiler alert here is that no, we're not going to reveal any keys to immortality or anything like that this morning. So can aging as a whole be reversed?
You found the fountain of youth.
Yeah, we found fountain of youth, and I'll become the LuLaRoe of vitamin supplements, I'm sure, very soon. So even though that's not the case, we can stay in a state of balance and stay whole. And a great example outside of practice that I think of is when I was in my early 30s. One of the groups of people that I sailed with on a couple evenings a week was a group of people my age, and the skipper of the boat was a woman who was 90, And she'd taken up sailing at 50 because she had an anxiety disorder, and her doctor told her to get something that would help her. And she had a boat called Tranquility. And at 90, she was on the boat at the helm. Us young kids had to go up and do things like go to the front of the boat and tighten sails, but she could stand up and steer, deal with waves. We even had some heavy weather sometimes. You could tell she was elderly, and I sailed with her when she was 91. And it's just an example that sometimes it's a little bit of luck, but it's possible that even though people might have less organ reserve, slightly slower reflexes, can't put their body through as much as they used to, they can still be essentially who they are. So what happens as we age? Well, our cells exhaust their replication cycles. Our cells have a certain number of replications. The exception, of course, are cancer cells, which you could argue are no longer our cells, but cancer cells have a certain immortality, but not in a good way. They ravage things. Telomeres shorten, so the ability to line up chromosomes and have a cell divide and make two new daughter cells, that starts to become impaired. Mitochondria, the powerhouses of our cells, become less powerful and dysfunctional. Their membranes start to become less efficient. Their numbers decrease. And this is really important. These mitochondria showed up in eukaryotic cells, like the kind of cells we have, I imagine hundreds of millions of years ago. And they're, without them, we can't really energize our body. And this is an interesting source of decline. Mistakes in gene replication leads to mutations. It looks like the way I put this image in here, it caused a mutation of sorts. But genes get replicated, and most of the time it goes pretty well, but little miscues, little mistakes get made, and sometimes they're trivial, sometimes they get spotted and deleted, sometimes they persist, and because of that, it leads to a mutation, which down the road can lead to the lack of an important protein, or lead to a series of events. It's not overnight, but a series of events that leads to a cell that we'd identify as being a cancer cell, a neoplastic cell. So these mutations are serious business. At the tissue level, if we move up from the cell to the tissue, which is, when we think about a patient in naturopathic medicine, we try to kind of scan from, smaller levels of organization to higher levels. But, we see kind of gross changes. The lining of the arteries become abnormal and sometimes ridden with plaques, right? Cholesterol plaques. Bones lose their density. Joints show signs of degeneration, and the skin loses its elasticity. Now, the interesting thing with the degeneration of joints as well is that the nature of the cartilage in our joints start to change. So I remember, reading about this 30 years ago, and they knew that the cartilage would kind of start to have like little tears in it, and then it would thin out. So it was kind of like the sole of your shoe, right? It's just the more you walk, it thins out, and you have your shoe resoled if it's a really nice one, or you toss it and get a new pair. It's not that simple. The nature of the cartilage starts to change, and it becomes disorganized and brittle. And even though it's not that vascular, cartilage doesn't really have a blood supply. It gets passively nourished by the fluid in our joints. That cartilage starts to stop operating like a well-organized matrix, and it becomes disorganized. And once it becomes disorganized, it's very easy to injure. Instead of a regenerating thing that can kind of respond to stress, it actually does start to become more like the rubber on the bottom of our shoe. It just, wear and tear will grind it down, which it's really not supposed to do. The heart's another good example. So as our heart ages, like a lot of tissues, it becomes less adept at dealing with oxygen-free radicals. So where do these oxygen-free radicals come from? Right within the heart muscle cells themselves. The heart is the ultimate aerobic muscle. It never takes a coffee break from, whatever week. I'd have to ask my Tri-3 students, but um, I'm guessing around week 4 or 5 or something of development, and it just keeps beating. Well, those tissues keep contracting at any rate. And these mitochondria that are in the heart muscle cells take oxygen and, create energy through oxidative phosphorylation. But that's a lot of oxygen to handle. And some of it escapes, and we get these kind of free electrons that can bounce around and attack things, cell membranes, genes, organelles of the cell. So it's interesting, as the heart takes a sort of punishment over decades, what should be very, very tiny blood vessels that perfuse the heart become replaced with connective tissue. So think of it like this. We all know the big coronary arteries, right? We're all aware of the idea the heart has these big blood vessels that wrap around it, and if one of them gets blocked, they say, you've had a heart attack. But remember that those are just the tree trunks. There's also branches and branches of the branches and tiny branches and stems, just like a tree. So what starts to happen with aging is those little terminal branches or even stems that ultimately deliver the blood to cells, they recede and they get replaced with just kind of filler tissue, right? And there's reasons for that. So one thing I'm really interested in these days, doing a lot of reading on, is the extracellular matrix, right? Cells, of course, are what our body's made out of, but they don't just operate in isolation, right? They function within a matrix that allows gas exchange to happen, immune cells to walk around, so to speak, nervous signals to get conducted, toxins to get drained away through something we called lymph. And interestingly, as this aging progresses, we see more immune activation. We see growth factors that come along in a way that we don't want. So what starts to happen is the heart is seeking more oxygen and energy. It has fewer mitochondria. During heavy exercise, the muscle cells get very hungry for oxygen, so the person finds they're winded easily. There's more of these free radicals, reactive oxygen species. So just sort of unpaired electrons that are, causing damage. There's an uptick in inflammation, which the body always responds to any kind of injury with inflammation. And then when there is damage, immune cells show up, which is why, I cut myself not very seriously Sunday doing some yard work. And what happens, of course, is immune cells show up and then activate cells that make fibrous tissue, right? That's why I didn't need stitches for this, because it wasn't very wide. But collagen, fibrous tissue, starts to get spread out. So my skin basically mended itself. So when this happens to a very, very specialized, highly organized tissue like heart muscle, it's good to a point, and then it's not so good. What starts to happen is these metalloproteases get expressed, and they start to replace very organized tissue with something that's like scar tissue, not as thick, but basically just connective tissue, the body's duct tape. And of course, that means that blood can't flow deeply and get to every single cell that needs it. And like if you get a test at a hospital where they use a very, very, very weak radioactive compound to see where blood really goes to, it'll show that the heart doesn't, this sounds horrible, but it doesn't glow as brightly as it used to when you get that kind of nuclear imaging. So the blood doesn't wash into all the areas it's supposed to. And then heart function declines. So even without having a heart attack, people's hearts can slowly start to shut down. So there's a good example. So how do we think about healthy aging naturopathically? So, the premise is there's things people can do to imitate or kind of learn from populations that have a lot of healthy elderly people and elderly people who have a high activity level and can do a lot of things. So there's one book about this. I think there was a follow-up one, but about blue zones, areas where there just seems to be a lot of very healthy people in their 80s, 90s. Of course, that in the media and in popular writing, it gets exaggerated a bit. And, when some researchers have gone back and looked at the data around, say, Okinawa, which is, island in the Japanese islands that's kind of to the south, it's not quite as dramatic. Of course, when people are really sticking to a traditional lifestyle, they're living in harmony with the seasons. They're strongly supported by their community. Their level of happiness is pretty high. They actually have downtime. They don't try to work 7 days a week. They have quite a bit of plant foods in their diet and often high levels of omega-3 fatty acids. And they don't overeat, and they move. They never stop moving. So they walk, they ride their bicycle, they garden. But the idea of sitting for hours a day in front of a screen and then being in a vehicle and then going to a place to see a movie and then going to a restaurant to sit down and then driving home and then sitting on the couch, they don't do that. I mean, they sit down sometimes, but there's a lot of movement. When the body moves, a couple of things happen. One is circulation of blood and lymph increases. Another is that the fascia, you've seen fascia on like a chicken drumstick. It's that glistening white stuff. It sort of holds muscles together and it helps kind of define our structure. If you've ever tried to change your posture, you've come up against the fascia. It sort of likes to keep things the same. Your fascia gets a good stretch, and the movement also sends a lot of signals to your brain. We think of the brain as the chip that executes the software to move our body, which it is. It gives commands, but the sensory information of moving goes back to the brain and actually activates it and even gets the brain to make new connections, new pathways. So movement is really important. I know that it's hard for some people to move, and I don't want to, in mentioning blue zones, ignore the fact that genes, difficult life circumstances, disparities in healthcare, inequities, accidents, just plain bad luck sometimes can interfere with people's goals to healthily age. I know with my own father, he had this huge history of heart disease. It seems to have missed me. And he did a lot of things right. Never smoked, exercised like crazy, but he had to wrestle with it, and it bedeviled him for the last 30 years of his life, right? So it's, but even then, he adopted new habits, and I think he did almost make it to 90 because of his commitment to healthy aging. And he got very interested in dietary supplements about 1994. Okay, so these blue zones are interesting to look at, right? So actually, this lady looks a lot like my old skipper, Liz, interestingly. But, it's worth taking a look at, right? Because what is going on that it's more common in that area, or what are those folks not doing? So we think about reality versus fantasy. Some people have a head start with this ability to age healthily, right? But some people have things to overcome, and yet if they try to do the best things they can for themselves, they might be in better shape in their 80s than someone who just has this great constitution but has really abused themselves, right? So I always think of Rick Hansen. I grew up in Canada. I live in the Chicago area now, have for quite a while, but Rick Hansen raised money for spinal research, and I forget, I think it was a car accident, but he had paraplegia, so his legs his legs were not responsive to his brain. And I think he went all the way across Canada. It was some ridiculously long journey. It was the Man in Motion tour, and he raised a lot of money and a lot of research profile. So, just using his upper body, essentially, he traversed, the world's second biggest country. So when people have a will to make certain changes and get somewhere, maybe they won't become famous, but it actually accesses resources they often didn't know that they had. And that's one thing we try to do in naturopathic medicine, is help people awaken to those resources. So with the aging, try to address the determinants of health. We try to stimulate self-healing, which can be done in a lot of ways. Meditation, acupuncture, homeopathy, for many people, prayer or connection with their form of worship or sense of goodness in the universe. Lots of things. Tai Chi, Qigong, yoga. We use nutrition and physical medicine and botanicals to support weakened organs and tissues, right? Everybody has something that's kind of their Achilles heel. So we try to strengthen that up if it's weak. Natural pharmacology. So some herbs have compounds that bind to receptors, and often herbs can be a very gentle kind of pharmacology. And I mentioned to you about movement. So very, very important. Our tissues become stiffer and less hydrated. So obviously we have to hydrate, but continuing to move is extremely important. It's not just about, well, it'll prevent back pain, which it might, but it goes much deeper than that. We also look at ways to increase circulation. So hydrotherapy, which can be done in kind of a very gentle, passive way, like this wet sheet wrap here, which the body will actually warm this sheet up incredibly. We modify this for people who have less vitality, less vital heat, less circulation, diabetes, things like that. Things like infrared saunas can also be fantastic too. With diet, with aging, we really have to look at nutrition, and we realize that even if there's good food choices, which often there isn't, I've seen great and horrible diets in the elderly. Getting the goodness from food can be a challenge because of dental issues, improperly fitting dental plates, bridges, crowns, sore teeth, difficulty swallowing, not enough stomach acid to denature protein, and the pancreas over time. For all of us, the pancreas will make less of its enzymes. The pancreas does a few different functions, but it secretes these enzymes that literally dissolve food, right, in our small intestine. So sometimes we supplement pancreatin just to help that out, because if you can't break it down, you can't absorb it. If you can't chemically work with food, you can't really harvest the nutrients that are in food. And we look very carefully at all the steps of digestion, as well as the shopping list for patients. So I just listed some things here that are very commonly deficient, and I mean commonly, like vitamin D. Probably 20% of the population over 65 is deficient in D, not optimal, textbook deficient. And there's lots of examples there. So here's a quick patient case, and then I'd be happy to do some questions if any came up in the chat. A 74-year-old female presents with very early stage diabetes, dry skin, pruritic rash, so that's itchiness on both legs, palpitations, difficulty concentrating, and fatigue. When I examined her legs, there is a lot of blotchy looking areas on the legs, below the knees, especially up on the shins, right, anterior surfaces. And these reddish macules, so like a flat patch with these little purple starbursts configurations on them. But she doesn't have a fever. It's a little warm, but it doesn't look like cellulitis. I don't think she has like necrotizing fasciitis or something. It's chronic. Her blood pressure is normal. She reports having used hormone replacement therapy from the age of 51 to just 9 months previously. So her doctor read a report saying it can increase the risk of cancer. There's some truth to that. These were synthetic hormones. So he immediately took her off of this prescription. So my assessment, she has venous stasis due to long-standing varicose veins, but made much worse by decreased cardiac output. She has had some tests. She's not dying of heart failure, but her heart does not kick that blood out like it used to. So the circulation is pooling down in her legs, and it puts a lot of pressure on those veins, and fluid or even blood is leaking out sometimes. So it's causing this itchy dermatitis and swelling. Now, she seems to have aged. She showed me a picture of herself from 5 years ago. She seems to have aged really rapidly. A lot of the subcutaneous fat in her face just melted away. Her estrogen and progesterone levels, of course, after 23 years taking hormone replacement therapy, her estrogen and progesterone levels went from that of, I would presume, about a 35-year-old to almost zero in just weeks. So she just got cut off of this. She didn't have cancer, but it was, I guess, to preempt that higher risk. So her adrenal glands, her fat tissue didn't have time to adjust to this because those tissues can make a bit of estrogen. So she's gone from basically like somebody 40 years younger than her to almost nothing in just weeks. So of course she feels terrible. And there's the beginning of non-insulin dependent diabetes mellitus. So treatment, we change the diet at every meal. We add sources of omega-3s. We tripled the fiber intake. We reduced added sugars. Eating 2 servings of fruits and vegetables at every meal. And the advice, I reinforced was, different colors on the plate, right? Some green, some reds, some purples, some yellows. Try to limit portions, and then resume workouts at the health club, but don't overdo it. Don't try to do the whole weightlifting circuit like you did when you were 60. Maybe you'll get back there, but emphasize flexibility. Go for walks, pay attention to your garden, increase your water intake. And then, having addressed some of these determinants of health, we did do some supplements. So I put her on Genistin, which is a soy isoflavone. It binds to estrogen receptors in the body. We did horse chestnut extract, which and high doses of vitamin C, which strengthen vein tissue and other parts of the circulatory system. The third thing new for her was high doses of coenzyme Q10, which is really important for those mitochondria functions. I was showing you these guys before right here. So they have many enzymes, but coenzyme Q10 is like the spark plug of this thing, and that becomes deleted with aging. So we supplemented that. She did take a multi. I got her to change to one that was better quality, better absorbed, right? Less of a tablet and more of an encapsulation with forms of minerals that are easier to absorb. So 3 months later, her legs have returned to normal. She didn't need to use the steroid cream that was prescribed for her, which would probably have thinned out her skin. Energy's feeling good. Her blood sugar has normalized. Long term, she did have early congestive heart failure, at the start of this work, but with good conservative allopathic treatment and naturopathic treatment, patient, remained very high functioning and is still trucking along years later. So I love this kind of medicine because it taps into the abilities that we all possess. People rediscover their ability to heal. It's individualized, so it doesn't feel like check the boxes or boring. I mean, it's never boring to help another human being, but the work itself is quite individualized. And, regardless of what someone has left, there's choices they can make today to make things better. Even toward the end of our life, there's comfort, there's things we can do, but until that time, there's always things that we can work with. Our bodies are designed that way. So if you're thinking of studying this, keep in mind that it's like 2 careers in one. You learn to be a doctor who can see patients in primary care setting, but also it's a branch of medicine that really looks at setting the stage for the restoration of someone's health. So my 12-year-old daughter's watching Grey's Anatomy from season 1 onward right now, and my younger son said, "Have you ever been in one of those heart transplant things?" And I said, "No, that's not the kind of medicine I'm in. I think it's awesome for someone who needs it, but I'm more about getting the flame to burn more brightly. But if you're into that work, take a very, very serious look at us." So that's the end of the presentation. Let's see if we can do this, and bring Zoom back up. Perhaps not, but I can certainly take questions at this point.
Thank you so much, Dr. Smith. So before we go into questions, I just wanted to let folks know that we have some upcoming events. So in October, AANMC is going to be part of the UC Davis Big Fair, and we will have panels of admissions folks and naturopathic doctors at UC Davis. I will also be speaking to you next month on October 20th on pandemic reset. So if you've been stressed, if this pandemic has really kind of taken you for a loop, come join us next month. And then on November 16th, we will have a virtual fair with representatives from all of the naturopathic colleges. So really looking forward to these next events, and we hope that you can join us. Just a reminder as well, we will have a recording of today available on our website, and it will also be emailed. So with that, we've got some questions for you, Dr. Smith. So in the patient assessment example, how did you treat the hormone deficiencies and corresponding aging effects that were possibly exacerbated by the abrupt cessation of the hormone replacement therapy? And kind of a part 2 to that is any tips for natural hormone replacement in postmenopausal females?
No, that's a great question. In her case, the genistein was important. I don't think everyone needs to try to manipulate their hormone levels. And of course, isoflavones like that they're not actually estrogen. What they do is that they go to the same receptor in the body that estrogen goes to, bind to it, and weakly stimulate it. The thing we found out about them in the last 10 years or so is they recruit certain things called protein chaperones when they bind, that literally chaperones or takes them to the cell nucleus and activate genes that we associate with an estrogen-like effect. So you could say that they punch above their weight category. They have this outsized effect. So they're deceptively mild. They can actually do quite a bit. So in her case, because it was such a jarring transition to go from way up here to almost nothing, she really needed that kind of natural pharmacology. For someone not in that situation, I think really having fermented foods and a lot of legumes, not just soy, but all the legumes. There's so many kinds of beans and everything, and plant foods can be excellent as well. Or maybe not as concentrated a dose like genistein, maybe like red clover tea or something like that. So it's about keeping some kind of balance. But after 24 years of hormone, synthetics like Premarin, which is made from the urine of pregnant horses, by the way, that's where the progesterone came from in that drug, there's no turning back. So it was just unfair for her to try to rebalance. You can't undo those 24 years. So she felt great with genistein. And there's other reasons to use it too. There's a strong family history of osteoporosis. Even if they're taking their vitamin D and they're doing weight-bearing exercise, there's a really good argument for using like what we call phytoestrogens, plant, but it's a little misleading. They're not actually estrogen. Good question, though.
Thank you. So, I have a few questions that have come in elsewhere. If you could just talk about, the 2 or top 3 things that you would recommend for someone to have a healthier golden age of their life, what would those be?
The top 3? I'm glad I don't have to think about this too seriously right now, but it's it's a great one. One would be um, take a serious look at nutrition and don't think so much about sensible eating, but think about eating in traditional ways that really agrees with our bodies. So, I mean, no book is perfect, but um, books like Kate Shanahan's Deep Nutrition has a lot to say about that. I don't quite agree with all of her conclusions, but you know, I love her four pillars. So plant foods, fermented foods, yogurt, sauerkraut, kimchi, tempeh, miso, anything that's fermented. People used to drink or eat ferment foods all day until just about 40 years ago. And then I remember as a kid, it's like there was like Dannon yogurt, which is about as far away from French yogurt as you can get, right? And is really a terrible omission. And I'm just kind of talking about standard supermarket food. There's many exceptions, but um, you know, things like bone broth. I mean, um, that never went away for everybody. Like meat on the bone or broth made from bones. I heard a great presentation at our convention this summer. Our keynote speaker was saying, in her African American family lineage, her grandmother made bone broth like all week. So when it appeared at the health food store, that didn't enlighten anybody in her family. It just made it more expensive to get soup bones, right? Dr. Yanis was there. So, that, and some people hate them, but, and you can be perfectly healthy without animal flesh foods. But if you do eat them, not just like white turkey breast stuff, but those things like liver, kidney, things like that. But so there's not just one way to go, but I would really tell people, don't just think about sensible eating. Think about eating in a way that, and if you look at those blue zones, people are eating this. They're kind of following the same rules, right? Just in a different culture with different menus. The other thing would be to keep moving, and it doesn't have to be what you saw someone on Instagram doing. I'm not going to tell my 85-year-old patient, you got to do 100 burpees this morning. Maybe I shouldn't tell myself that, right? I'm not going to say that. But, I mean, it's kind of a meme now, but people doing Tai Chi in the park, or there's dozens of things. So just find the shoes that fit and move. The third thing would be, those connections and relationships. And, I remember this one patient who had this youthfulness about him, and he was a widower. His wife had died, but he had these 3 daughters who lived very nearby, and he was part of this very close-knit community. It was it was kind of a smaller community of people who had immigrated to Toronto, and like about 1,000 people, but they were super close-knit. And so, every weekend he was at a party, a wedding, a card game, and it's not so much being a social butterfly, but it's about connectedness to people. And that could be phone calls too, right? I mean, it doesn't have to be giant weddings. It could be phone calls, but isolation is absolutely toxic to all of us. And I think not feeling needed, a loss of purpose, and
there's strong data about social support and health. So very, very strong. So I'm going to just move us over because we do have a few questions coming in here. So, very common condition, Dr. Smith, and I know this talk wasn't totally on this, but I know that you know about this topic, so I'm not going to gotcha here. So overweight, 65-year-old patient, high blood pressure, type 2 diabetes. What would be the steps that naturopathic medicine would take to help a person in that type of situation?
We'd look at all the disturbed determinants of health first: sleep, nutrition, hydration, exercise, and then move up to some kind of nutritional supplement. Obviously, my guess would be diet would change. And that might sound trite, like, stop drinking, 32-ounce Slurpees at lunch and things like that. But it's not trite. When you inventory these patients, usually for years, there's been literal requirements of health that they haven't been able to achieve, to meet. And it's not just dietary sugar, it's a lot of things. So we try to put all of them back. We want them, you know, we want their battery fully charged. So that's where we'd start.
Thank you. And, a lot of what you've been talking about has to do with lifestyle changes. And so those can be some of the toughest to implement for people, just because, like you said, like somebody might have been doing this for many decades. And so how do you switch that around? So what have been some of the most effective ways that you have found in your years of practice to help people implement those lifestyle changes?
I try to put things in terms that make sense to the person. If they're a big reader, they consult with Dr. Google a lot. They have a lot of facts. I try to discuss mechanisms a bit. If they like being coached, I try to coach. If, they're like your prototypical Generation Xer and they don't like anybody telling them what to do, they work for themselves, all of that. I try to help them see where they can make changes and kind of do it for themselves. And some people are different on different visits. So I try to be honest. I try to be factually correct, and I try to meet people where they are. Early practice, I tried handing out all the homework and giving lectures and scare tactics and using $20 words, and it's hit and miss. And it's just better to make it about them.
Very good. So, you mentioned some supplements, and I just want to caveat that this webinar is not supported by or promoting any one specific brand. But in general, how many supplements is too much? Like when does that supplement pill burden become too much? And how do we balance that as NDs?
We got to watch that. And what I found is I would perform the bag test.
Can you move your microphone back down?
Oh, yes, there we go. Thank you, Doc. I would perform the bag test with patients, and my interns always say, the bag test, we never learned that. They would bring in a bag or a shoebox with all of their supplements and prescriptions and then dump it out on my desk. And sometimes it looked like some kind of a gift bag. Like there would be 20 things. How did they get there? Because they read a book, they saw an ND, they saw a homeopath, they went to a webinar, they did this. Pretty soon they've collected 20 things. So how to avoid that? I think starting from a baseline is important, and to say, what do we need, right? What do we really need? What are the highest priorities? Let's try to get what we can get from food, and then use supplements, like my friend Louise Edwards says, literally as supplements, right? Or very targeted natural pharmacology. So someone with a chronic illness, to me, it's okay if they're on 6 things, right? They could be in the hospital. Someone who's just trying to maintain health, probably 3 things, right? Everybody's got different situation, but you got to really watch it. And Dr. Yana has mentioned, lifestyle and getting to those fundamentals. If you don't do that, then it's easy to start throwing a different supplement on each visit at someone, so that, because they have issues, and it's not efficient. It's like trying to hold the body together with duct tape instead of doing like structural repairs.
Well, and I also want to add too, one of the core tenets of naturopathic medicine is treating the cause. And we tend to like to, I think people are conditioned, oh, I have a problem, I take a thing for the problem, or I do a thing for the problem. Whereas naturopathic approaches really, looking at the totality of the person and finding the root of the issue, rather than just, here, take this herb for your headache instead of a Tylenol, and so, I think there is education that also has to happen with our patient population too, to help people understand that it isn't just replacing the drug or the conventional pharmaceutical with an herb or a natural product, it's really a different approach to healthcare, honestly, altogether. So, so when you are trying to say, oh, well, I've got 5 symptoms, I need 5 things, there might be one thing that's the root cause. So, that's really where, and naturopathic medicine gets to the root of the issue, is uncovering and helping people really uncover what the core problems are. So, Dr. Smith, there was a question here about DHEA supplementation. I know you had the person who had coming off the patient who had coming off the hormone replacement therapy. There was a question of, is DHEA supplementation something that would be helpful in that population?
Yes, I think perhaps long term it'll give the adrenals a substrate to work on. They may or may not need it, but DHA is like the starter molecule. But the adrenal glands would take that and make different types of hormones. So in this case, she needed something faster. Long term, some people feel good on DHEA. It's kind of like the starter block, which I think some people need more than others.
So one thing came in here, and I know you didn't quite address this specifically, and we have had other webinars talk about this before, but memory. And I think one thing that people sometimes worry about as they age is, memory and cognitive function. And so can you talk a little bit about some tips and tools for helping keep our brain as sharp as we can as we age?
Sure. That's a great one. Vascular health, which we talked a little bit about. So the brain has a vast network of blood supply, so that's really important. So the same nutritional principles. The brain doesn't beat like the heart, but it's just as much of a glutton for oxygen. So you got to have the blood supply. Movement, like I was saying before, it's not a one-way street. The brain needs movement coming back to it. And even if you're Rick Hansen, who got across Canada using upper body strength, but move. The other thing is, and this seems to be particularly important, is learn something or do something that you're not already good at. Again, it might sound kind of trite, like, oh yeah, my aunt does Sudoku or whatever. Sure. There's a lot of solid research around the fact that in the learning part of the brain called the hippocampus, Latin for seahorse, it looks like a little gummy worm sitting right in the middle of the brain. That is the read-write tissue for new memories in the brain. And if you go to do something like learn a new language, travel and get off the tour bus and learn something, anything, it actually sparks the creation of new cells in that seahorse. Like literally new stem cells come out of the woodwork. Even into your 90s, you can still hatch new brain cells and new memory cells, but the brain will only do what it's asked to do. It's actually very cooperative. If you ask nothing from it, it'll involute. If you ask something from it, which is why, in my opinion, you see people like Supreme Court justices and business owners and things that are still constantly learning. They seem to stay sharp.
No, that's a really wonderful point. I think keeping the brain active, and again, some of those social support things, making sure that you're feeding your spiritual, your emotional components of your life too is really important. And there, like Dr. Smith said, there is solid research about keeping your brain active, and if you don't use it, you do start to lose it. I think anyone who has ever learned a foreign language, what happens if you go 10 years without using that foreign language? You start to lose pieces of that. But then if, let's say, you travel to that country where that language is spoken, it will start to come back as you use it. It might be a little rusty at first, but it will come back. And so I think it's really important to recognize as we age, even if you retire, keep active. I think of I've got octogenarian aunt and uncle who I just adore. And they have for years, been retired for years, but for many years been involved in senior learning centers where, they will go and each person in the senior center takes a turn learning a subject and teaching a subject to everyone. And they all just kind of round robin it and they find something they want to learn about more. And, my 80 something year old aunt learned how to create a PowerPoint. So, it's
Nice.
the sort of thing that really keeps people engaged in life, but also keeps those brain cells regenerating. The exercise, like Dr. Smith said, is very important for blood circulation. And then, keeping those antioxidants that are in your colorful fruits and vegetables as part of your regular diet. So, I think that's all really important. So we're wrapping up here. We are just just coming up on the end of the webinar. So Dr. Smith, do you have any parting words that you would like to leave folks with as we wrap up today's session?
Well, if you're looking for a way to help people in all kinds of circumstances, think about naturopathic medicine. You've taken a great step by learning about AANMC resources, and we're always here to answer your questions. So keep moving, keep eating real food, actual food, and have a great day.
So with that, we're going to wrap up for today. So Dr. Smith, thank you so very much. I know he's got to get to classes, and so we're closing up a little early here. But thank you so very much. I appreciate all of your contributions to our profession and to potentially letting future students know all the ways that they can use this degree. So with that, we're going to wrap up today. Thank you, Dr. Smith. I hope you have a great rest of your day. And thank you all for coming, and hope to see you again at another event. Take care.
Thank you. Bye, everyone.